Good afternoon, my fellow students and our lecturer. My name is Nkwasibwe Alex Pafura, a student at Victoria University doing Bachelor's in Nursing top-up. Today, I'm here to present on psychology topic, stress and coping. The aim of this presentation is to explain the concept of stress and coping, discuss the different types of stress and coping strategies, and demonstrate how these concepts apply to everyday life and nursing practice. Therefore, stress is a psychological and physical response that occurs when an individual perceives that the demands placed upon them exceed their ability to cope. Stress is a normal part of life and can affect people of all ages. Psychologists describe stress as body's reaction to challenges, threats, or changes. When a person experiences stress, the body activates the fight or flight response. During this response, hormones such as adrenaline and cortisol are released, preparing the body to respond to the situation. Therefore, there are different types of stress. We have acute stress, we have chronic stress, and acute stress. Here, acute stress is short-term stress that occurs in response to immediate challenges or pressures. Examples include preparing for an examination, giving a presentation, or responding to an emergency situation. Chronic stress. Chronic stress is long-term stress, the chronic for weeks, months, or even years. It may result from ongoing financial problems, family conflicts, work-related pressure, or chronic illnesses. Stress is positive stress that motivates individual to perform better. Examples include preparing for graduation, starting a new job, or participating in competition. That is all about stress, types of stress. If stress is not managed properly, it can affect both physical and mental health. Common effects include anxiety, fatigue, headaches, sleep disturbances, difficult concentrating, and increased risk of illness. To manage stress, of course, people use coping strategies. There we go. Coping. Coping refers to the thoughts and behaviors individuals use to manage stress situations. Psychologists generally classify coping strategies into two main categories. One, problem-focused coping, whereby this involves taking direct action to solve or reduce the source of stress. Examples include creating a study timetable, seeking information, improving time management, or asking for assistance. Number two, emotion-focused coping. This involves managing emotional reactions to stress. Examples include relaxation techniques, meditation, talking to friends or family members. Prayer and engaging in enjoyable activities. Effective coping helps individuals maintain physiological well-being, and improve their ability to handle life challenges. Application to life experiences and nursing practice. Stress and coping are highly relevant in everyday life. For example, many students experience stress during examination periods. They may feel anxious about their performance and future success. A student who uses problem-focused coping may develop a study schedule and seek help from lecturers. Another student may use emotion-focused coping by practicing relaxation techniques and maintaining social support. Stress and coping are also very important in nursing practice. Nurses frequently encounter stressful situations such as caring for critically ill patients, managing heavy workload, responding to emergencies, and dealing with emotional situations involving patients and families. Consider a case scenario. A newly employed nurse is assigned to a busy medical ward. The nurse feels overwhelmed by the workload and responsibilities. As a result, the nurse experiences stress, anxiety, and difficulty concentrating. To cope effectively, the nurse may seek guidance from experienced colleagues, improve time management skills, participate in stress management programs, and maintain healthy lifestyle habits. Understanding stress and coping helps nurses provide better patient care. Nurses who manage their own stress effectively are more likely to communicate well, make sound clinical decisions, and maintain professional relationships. In addition, nurses can help patients cope with stress by providing emotional support, health education, active listening, and appropriate referrals when necessary. In addition, nurses can help patients cope with stress by providing emotional support. Therefore, knowledge of stress and coping benefits both healthcare professionals and patients. In conclusion, about stress and how you can cope up with stress. In conclusion, stress is a natural response to challenge situations, while coping refers to the strategies used to manage stress. I have discussed the different types of stress, including acute stress, chronic stress, and excess stress, as well as problem-focused and emotion-focused coping strategies. I have demonstrated how stress and coping apply to everyday life and managing practice. Understanding these psychological concepts enables individuals and healthcare professionals to promote mental well-being, improve performance, and provide better patient care. Thank you, my fellow students, and thank you for giving me such an opportunity to present a video presentation. I salute you, my lecturer.